Today we're going to be talking about patellar tendonitis. It is one of those things that's very common, and you're going to see those runners out there with braces on their knees. These are the things that usually they're trying to address, yet they have no idea how to kind of deal with them. So do yourself a favor, don't be one of those people. Watch this webcast video and you're going to realize that there are different things you can do to combat this problem without actually getting a band and being one of those people. Usually if I'm running down by my place, I'm going to see at least a couple people with some patellar bands on. And a couple of times I've seen people wearing two patellar bands, one on different legs, and it's, you know, you'd think at this point they would have addressed the first leg and stopped running and really kind of handled that before it went on to the next leg. And I'm not one that actually tells people to not run, and I'd like to put them through their training while they're being treated. And a lot of times they won't decrease their training time, which is really great for them, but at the same time, I mean, that's just neglect. I mean, you can't have you can't keep going and going and going and not get proper treatment. So I'm going to show you a real quick close-up here to kind of find out what the patellar tendon is all about, where it attaches, where it originates, and really what the problem is with patellar tendonitis. First, we'll start here with a close-up of a actually anatomical figure. We're going to switch to a picture after this, but really all I want you to see here is, obviously, let's pan up. Let's see, the foot is facing forward. There's the shin or tibia. Here is one of the tubercles on the tibia. This is actually where the patellar tendon attaches. If I were to turn you this way, you'd see, let me simulate a kneecap. Here's a kneecap, and upward is going to be the thigh and the muscles of the thigh. And really what we're looking at, and we're going to see on this picture here, is that you have the patellar tendon is an extension of the fascia that comes down from the quad. So the quad muscles are the muscles in the front part of your thigh. They come down, they attach the patella, and further on down they become a very tight fascial structure known as a tendon, which then attaches onto the tibia. When this tendon becomes inflamed, a lot of times that strong contraction coming from the quad will actually irritate this area. And basically all those patellar bands is they're stopping that contraction from getting all the way down to the insertion point onto the tibia, which is basically most of where the inflammation occurs. Not only you have to address the inflammation right there at the insertion point of the patellar tendon, but you also have to address all the muscular components of the quad, because they all go down in there and they attach into the same area, and a lot of times tightness within the quad area translates into increased tightness of the patellar tendon, which then leads into the start of the cumulative trauma disorder, which you can read more about. Basically, I'm going to show you here is, I've had this demonstration in some of my other videos. Basically what we have here is a messed up mop. What you really need to know is when there's problems within an area in regards to cumulative trauma disorders such as patellar tendonitis and all the other tendonitis issues, is that you have an area that should be more like this. It should be very pliable. It should be able to separate. And I'll get a little closer here. It should be able to separate. Now, if you can't separate these areas, basically you have buildup. You have buildup of scar tissue, which is almost like paint. And I should have painted this a different color because it's kind of hard to see. But basically what you have is fascial structures such as muscles, and you basically have fascial structures stuck together which aren't able to separate. They can't function properly, and sometimes you imagine this area now rubbing onto something else. When these areas kind of stick together, there's lots of adhesions, there's lots of inflammation in the area, and it causes lots of pain. So really what you need to do is, I mean, obviously rest is great, but I don't know how many times you probably had an injury where you've rested, taken some anti-inflammatory meds, and you go back out and run in a couple weeks or so and it comes right back. The problem is you need to release some of the scar tissue. A lot of times the anti-inflammatory meds and rest and ice and heat are not going to get rid of this on its own. Sometimes it takes mechanical pressure, someone going in there and digging with their thumb or a tool to actually break this tissue up. Active release is very good. There's grafts, and there's other types of deep tissue therapists out there who I think can do a very good job at this. Those are the two that come to me off the top of my head because I think they're very good. But obviously there's people out there, there's deep tissue therapists who are very good, who can address some of these problems. But the main areas that I usually address on the patients that I see with this problem is not only do I address the soft tissue component within their thigh, especially the rectus femoris, as well as the patellar tendon, is going to be a gait analysis. So you need to really look at these people as a whole unit. What caused this in the first place? There's probably some other strength issues or flexibility issues that probably aren't presenting if you're not looking. So get yourself a gait analysis. The place I use is runninganalysisonline.com. You send it in, you get it back. You don't have to go anywhere. You just videotape yourself with an iPhone. It's very easy. But realize that if you've rested for a while and you have this problem and you keep having to depend upon tape or a patellar tendon or a patellar brace rather, do yourself a favor and really get yourself treated, get yourself looked at, because a lot of times these problems can resolve very, very quickly. And I've had a couple patients that they've gone away within 4 or 5 treatments or so, and they're very happy. Don't forget to check out our ebook at the website below.